Conversion disorder is a diagnosis that is given when patients present with neurological symptoms that are not consistent with well-established causes. Welcome back, Straight Talkers. Today I'm going to talk about conversion disorder and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Conversion disorder, which is also known as functional neurological symptom disorder, is listed under the section somatic symptom and related disorders in the DSM-5. And commonly, it begins with some sort of stressor, trauma, or psychological distress. And it's important to recognize that in conversion disorder, the symptoms are not intentionally produced, and patients are not trying to get some sort of secondary gain from having the symptoms. And when we're talking about secondary gain, what we're referring to is when someone gets external benefits from having the symptoms, and this can include things like getting money or being released from daily responsibilities. When looking at the onset of this disorder, we find that symptoms have been reported throughout the life course. And when specifically talking about non-epileptic attacks, this usually peaks in the third decade of life, where people with motor symptoms typically have a peak onset around the fourth decade. And while we aren't sure what exactly the prevalence of this disorder is, we do know that conversion disorder is 2 to 3 times more common in females than males, and the prognosis is generally better in younger children than in teens or adults. So how do psychiatrists go about making the diagnosis of conversion disorder? There are 4 criteria that we evaluate for, and these are listed from criteria A through D in the DSM-5. Criterion A states that there are 1 or more symptoms of altered voluntary motor or sensory function. Criterion B states that there are clinical findings that provide evidence of incompatibility between the symptoms and recognized neurological or medical conditions. And what we see is that clinical findings are not consistent with the neurological diagnosis being considered. Criterion C states that the symptoms or deficit is not better explained by another medical or mental disorder. And Criterion D says that the symptoms or deficit causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, or warrants medical evaluation. If these criteria are met, the next thing that I'll do is screen for the 3 different types of specifiers that can be added onto the diagnosis. The first thing to specify is the symptom type, which includes the following options: with weakness or paralysis, with abnormal movements, and this includes things such as tremors, dystonic movements, myoclonus, or gait disorders, with swallowing symptoms, with speech symptoms, and this includes dysphonia or slurred speech, with attacks or seizures, and these are commonly referred to as psychogenic or non-epileptic spells, with anesthesia or sensory loss, with special sensory symptoms, and this includes visual, olfactory, or hearing disturbance, and then finally with mixed symptoms. After I specify the symptom type, the next thing to consider is the timeline of the disorder. And the episodes can either be acute, meaning that symptoms have been present for less than 6 months, or they can be persistent, meaning that the symptoms have been present for 6 months or longer. And then lastly, I specify whether or not the episode has been associated with a specific psychological stressor or trauma, and these can be either psychological or physical in nature. Whenever I make the diagnosis of conversion disorder, I will always screen for depersonalization, derealization, and dissociative amnesia, because many times these symptoms are present either at the onset or during the attacks. I'll also see whether or not the patient has symptoms consistent with an anxiety, depressive, or personality disorder, as these are highly comorbid with conversion disorder. If you have concerns that your child is struggling with these various signs and symptoms, please do not hesitate to reach out and make an appointment with your pediatrician or psychiatrist to get further evaluated. Now head on over to the next video to find out more ways that you can help your child live their best life.